So you do have to be aware of anatomical failure and the basics of how that works. And this is a good, good visual that it helps to explain it. So when you look at your joints, whether it's the spine or your hand or your elbow or your shoulder, you've got the active range of motion. That's what the patient can do on their own. That is the most limited. So that's when they can move on their own. Okay. The next, you can see the line up there. It says passive range of motion. That's passive range of motion with overpressure. Now, that has to be an external force. Overpressure is an external force, so whether it's a clinician, physician. An external force also includes if I was going to bend over and pick up a basket of laundry, the weight of the basket of laundry would take me into overpressure more than possibly active range of motion. So being aware of that also. So when energy comes in, and these are the words we use, energy. When energy comes in, the first energy, like energy meaning a car accident. When energy comes in, and by the way, you should be able to explain this to attorneys also. So it's just, if you're going to look at it from a personal injury standpoint, it's being able to explain it to patients. It's being able to explain it to attorneys. It's being able to put it in your narrative report, put it in your deposition and trial testimony on how physical medicine works relative to injuries. So this is anatomical failure. So energy comes in a car accident, and the first motion that it goes into is active range of motion. So if there's resistance in active range of motion, it'll help dissipate and absorb that energy, which decreases the potential injury of that energy. And then if there's more energy that takes the joint past anatomical range, or active range of motion, then it'll take it into overpressure range of motion. Again, there's no damage at this point. And of course, this is where the defense mechanisms come in. This is what your defenses are trying to do, is trying to absorb that energy and stop it going past these three ranges of motion into anatomical failure. So after passive range of motion, then it goes into the joint motion or the paraphysiological joint space. And that's typically what chiropractors know as the adjustment, or when you hear the clack, the elastic barrier is the crack, whether it's the knuckles, your neck, your spine, etc. And then once it goes past the paraphysiological joint space, now this is not much space at all. This is just a few millimeters. What if there's any energy? In other words, if all the energy is stopped up to this point, there's no injury. And then if there is more energy and it goes past the paraphysiological joint space, then you have the injury. So that's how the injury occurs. And of course, the amount of energy will depend on the energy, the injury involved, as well as other factors like the line of the direction of the energy, as well as the type of tissue involved. Because obviously the type of tissue involved are going to injure differently, whether it's connective tissue, whether it's soft tissue, or whether it's arteries or veins or fascia or muscle or disc. Okay. So having said that, also the direction. It's going to make a big difference in the direction of that energy. So it's the amount of the energy, the tissue involved, the direction of that energy. So as an example, a disc can hold a lot more weight with compressive forces. And one of the more weaker lines of force is a horizontal force, like a shearing force. That's one of the more weaker types of forces. So we do definitely want to know the basics of anatomical failure.